Finding Nemo by Spencer, Jonathan, and Jose. So, for our movie, we decided to choose Finding Nemo. In the fantasy setting, Finding Nemo, the father clownfish Marlin and blue tang Dory set on an adventure through the Great Barrier Reef to find his lost son Nemo. The character that we are focusing on and exhibits the mental disorder is the fish Dory. She is a prime example of anterograde amnesia. Throughout their journey, they ultimately reunite Nemo with Marlin, and the story ends happily. So our diagnosis. Blue Tang Dory is diagnosed with anterograde amnesia. In detail, this describes the loss of events after an injury due to damage to the hippocampus. It essentially disables Dory from forming new long-term memories, specifically explicit long-term memories such as semantic and episodic, though she can still learn procedural and motor skills. Doctor's diagnosis. So, in the fantasy setting, the fish do not have a medical system set up, so we can assume the degree of medical practice by the dentist that held Nemo captive around the 21st century. Clearly, any reputable 21st century therapist in the Californian region of the United States would come up with the same conclusion of anterograde amnesia in the case as severe as Dory's.
Jonathan Aviar, cultural diagnosis. In most cultures, there is conclusion that anterograde amnesia exists due to severity, as it displayed in Finding Nemo. However, there may be exceptions in more underdeveloped societies that are not aware and accepting of many mental disorders, as England was to schizophrenia during the 18th centuries. Stigmas. In modern-day U.S., there is an adequate accommodations for those with serious mental illness like anterograde amnesia. It is viewed upon as any other serious mental illness, a disability. However, parallels can be drawn to malingering amnesia, where patients exaggerate symptoms and fake amnesia in order to avoid criminal punishment or have financial gain. This is seen as devious and a nuisance to courtrooms who may have difficulty proving them false. Dory symptom. Number one, Dory is unable to form long-term memories, which may be due to hippocampus damage in the movie. Dory tells Marlin which way the boat that captured Nemo went after already telling him seconds before. Marlin becomes agitated at her repeating the same information until he realizes she has memory issues. Dory can still recall implicit memories such as reading English. In the movie, Dory is asked to read the name of the side of the boat in order to identify which boat was the one that stole Nemo. She does this without an issue. Symptoms unseen anterograde amnesia. One symptom not displayed in Finding Nemo is the ability to recall events before the injury. As in H. Ames' case, the patient should still theoretically have episodic and somatic memories already encoded from childhood, such as parents and home.
There is only a handful of treatments for anterograde amnesia, and none of them are guaranteed to work. There is hypnosis, which helps with lost memories. Nutrition can also help amnesia if you avoid alcohol, sugar, and try to eat more foods rich in protein and omega-3 fatty acids. Energy psychology uses acupuncture points. The EMDR uses two hemispheres of the brain to aid in recall, and there is also digital aids like a smartphone to set reminders. All of the treatments help patients with anterograde amnesia since they all aid in memory retention. As I stated before, none of the treatments are guaranteed to work, but hypnosis can help recover lost memories. There are no ethically concerning issues to treatment given patients' consent. Hindrances for treatment. There may be some issues concerning the nutritional aspect of treatments, especially with eating nuts. Protein-rich foods also may not be an option for some cultures, and acupuncture may be unavailable if the patient were a hemophiliac. Dory's portrayal. Dory's anterograde amnesia portrayed a lighthearted approach to the mental disorder, and it is accurate since she did exhibit many, if not all, of the symptoms of this type of amnesia. In conclusion, Dory is a prime example of a patient with anterograde amnesia. The movie helps us not only understand the difficulties that come with living with memory impairment and the support one may need in order to live everyday life with the disorder. We give this movie a 10 out of 10. It was heartfelt and wonderful.